Next from Springfield, we talked to two healthcare representatives, Greg Wilson of Peterson Healthcare and Steve Wanamaker of Heritage Enterprises, about the state's proposed cuts to Medicaid and how it would affect healthcare operations. This runs about 15 minutes.
What is happening relative to state funding and what impact are these proposals having on your operations?
Well, we found out, we've been in these discussions for several weeks about the F-15 budget. There was Senate Bill 317 and 318 were passed last week, and there were cuts to the industry in those two pieces of legislation that I believe totaled somewhere around $22 million. Sometime Thursday night, that changed, and the number became substantially higher than that, 58 million or so we found out Friday morning. So we've been spent, I'm sure Steve, as I did, spent the last several days, and we've been on conference calls together and with others in the industry to figure out how that substantial increase in the reductions occurred, and if there's anything we could do to stop that. These are obviously substantial reductions for our business. Steve and I both run fairly good-sized businesses, and it's hard to turn a business around and find $3 million or $500,000 or $1.5 million worth of cuts in 7 days. So we're right now down here trying to put the agreements we had originally back together and see if there's anything we can do going forward. Obviously, we see jeopardy in the 2016 budget as well.
Well, let me just, Greg, how many facilities do you run? And, well, let's start with that. How many facilities do you run? How many people do you care for?
We have 70 skilled facilities across the state. We go from the top of the state clear to almost Kentucky. I have around 6,000 employees, and we care for more than 5,000 residents of various types every day.
Do you know, we're talking about the amount of millions of dollars the governor's trying to cut out, but have you run the numbers as far as how would that directly impact your operations as far as how many dollars would you lose?
We have, the numbers are still evolving, but our understanding right now is that the cut for us for May and June, spread across May and June, will be about $3 million, which is substantial. We aren't a high margin business, so this cuts.
You are not in a high margin business.
We are not. This cuts. This isn't just trimming fat. This cuts right through muscle and hits vital organs for us.
And that's what I was going to say. And when you operate, and Steve, you could pipe in then too, and we'll get to that, but what kind of a margin are you? We hear grocery stores operate on a 1% to 2% margin. If you were operating with a margin where you make 80% or 60%, that would be one thing. If you lose $3 million, that's going to mean obviously you're going to, as you say, what is your margin of operation? Let me put that way.
We have a wide variety of holdings, so it'd be hard to narrow it down to this service. But certainly these cuts are 20% of my payroll for that period, and nowhere near what our operating margins are. So we already, by national studies, lose about $33 a day for every Medicaid resident. These would put those losses per day on Medicaid resident near $50.
And Steve, let me ask, you're also in that industry. How many facilities do you have?
We have 35 skilled facilities that we own or operate for others. We also have 6 supportive living facilities and some senior housing. Our margin, our after-tax margin is less than 1%, and we have a very thin margin. The cut that's being contemplated would cost our company right at $1.2, $1.3 million. We would lose money. We don't make that kind of money in 2 months that would allow us to have a margin.
I believe I'm correct in saying, in other words, what we're talking about, just to remind people, is so the Medicaid payments, and these are the federal program, healthcare for the poor.
It's a federal state program.
It's operated by the state, but it's a federal mandate, and then the state puts in some money as well.
Yeah, it's a 50-50. In Illinois, it varies across the country, but in Illinois, for every dollar the state of Illinois spends, $1 is matched by the federal government.
And so if Illinois cuts its compensation to you, does that mean you would lose then the federal dollars as well?
Yes, that's in particular one of the arguments that Greg and I are making to our elected officials. We leave federal dollars laying on the table when a dollar of Illinois contribution is cut.
It's a very inefficient cut.
Yeah. The whole premise that we're sort of a bottomless pit that they can just keep cutting is misguided. We can't. We have staffing standards. We have caregiving standards that the federal government sets that you agree to as part of the program. And at the end of the day, both of our organizations believe in high quality care for the people that we take care of. And the frontline caregiving staff is just devastated by the notion that we would have to make cutbacks in how they deal with caring for their patients every day.
Let me say, so on one hand, let's put ourselves in the term of the governor's trying to get a handle on the spending. Medicaid, health care, it's like the biggest item in the budget. So one would think he's going to make cuts where the money is. Relative to when they did this initial study about 2 or 3 years ago under the SMART Act, they found that 40% of the people getting Medicaid weren't supposed to be getting it. The people that you're caring for, and I'm playing devil's advocate, for the taxpayers out there that go, well, they're probably, getting this money going to people that don't deserve it. How do you qualify the people that you're treating and who are those dollars are going to that they should be, that they actually qualify under the program?
Several points. First of all, the Medicaid program is wide. It covers a lot more than just long-term care. So at the end of the day, we're talking about a qualified population. You have to apply for and be approved for Medicaid in order to be covered by the program. So there are Well Baby, there are other programs that are covered by the Medicaid program. The one we're involved in is long-term care for seniors. You've got to keep in mind that people come into our facilities, many people come into our facilities not on public aid, Terry. The family that's saved up or maybe had a family farm or what have you, they come in and they're there for a year and a half, and they run out of money and they go on public aid. We feel an obligation to take care of those people, and both of our organizations do that. And we feel that those taxpayers, you referenced the taxpayers, the people we care for paid taxes for many years and contributed to the ongoing responsibility of being a citizen. And we feel that as long as they spend down and meet the rules, they're every bit as deserving of care in our facilities as anybody else.
And just remind people who don't have anyone under this care, I mean, these might be individuals who had a stroke or have Alzheimer's. It's not like they can, and they're elderly, and I mean, maybe they don't even have any children or family to care for them. So you're kind of their only hope, really. Right?
In today's society, I don't know what your family situation is, but my kids live in Chicago and Colorado. If I need family, are they going to disrupt their life and come back? Our two organizations take care of people who are in need, and there in today's world aren't many options for most of the people we care for.
Let me ask you something. Aside from just saying don't make any cuts, is there anything that the governor's office could do? Maybe it's relieving some mandates that cost you money that you think are unnecessary. Is there anything that they could do short of restoring all the funds that would be helpful?
I'm sure there are things to be helpful to business. The workers' comp legislation that the governor's pressed forward would help all business, including nursing homes. There are, we obviously operate under a lot of mandates, and some of those that we can improve, and we forward proposals from time to time through legislation here to try to improve the regulatory process. But these are substantial cuts, and we're not going to touch these type of numbers with those type of reforms, at least in the short term, in May and June. So.
Let me just ask before time runs out. So we've been talking a little bit about you had these immediate cuts, which obviously is extremely difficult when it just gets dropped on your lap at the last minute.
3 million and 1.2 million.
Yeah. That's obviously substantial. Are you hearing anything about the 2016 budget as yet going forward? Is this going to be the level of compensation for the 2016 as well, or do you not know?
We don't know at this point. It's well known around the Capitol that FY16 is hanging over everybody's head. But I can tell you emphatically for our two businesses, neither one of us could sustain these cuts if they're put forward as the budget for 2016.
And Greg, you had mentioned that you're going to be losing money on every patient. If that's the case, how do you operate?
Well, that's been the case for years and years and years, and that's not our study. That's
how do you keep the lights burning?
Well, because we have a diversified pay sources. We do have some private pay residents. We have
so it's a bit of cost shifting from those who have insurance to cover what you're losing on the other people.
Exactly, but in this instance, we're about between 70 and 80% of our clients are health care is paid for by Medicaid. So this is the core of our business, and these kind of cuts are substantial. And Illinois already pays nursing homes. We have the 49th lowest rate in the nation. These cuts put us dead last, is 50th. And if we go forward, and I mean it was substantially, the Midwestern states around us pay for their Medicaid recipients per day about $170 a day. The Illinois average is $136, and these cuts slash that further by $16, $17.
I'm reminded one of the first things I ever heard, there was a woman some years ago, they were being paid so late by the state. She was running a facility such as yours. She says, I'm taking care of quadriplegics, and I can't make payroll next week. What am I supposed to do? Push these people out onto the sidewalk? So it isn't a normal business that you're doing that you can just shut down making donuts.
Exactly.
What are you going to do if you can't make your budgets work and you're taking care of these people? What would be your options?
Well, that's a very difficult question to answer that I don't have an answer for you this morning. These level of cuts were discovered Friday morning, and today's Tuesday. But there's no question that in our case, 70% of our expense is staffing. It's people. It's the direct cost of the employees who do the work.
Yeah, it's labor intensive. Right?
It's labor intensive. There's no way to use automation to provide personal care to someone. We both believe in quality care. Both of our organizations are dedicated to that. At the end of the day, we will not cut frontline staff that directly cares for people. But we'll have to take a look at some of those 5,000 regulations that are in the manuals that govern how we have to conduct our business, and some of the paperwork, and that gets at a question that you asked a bit ago. We're not saying just give us the money. We're coming with some suggestions for how the state could make some changes that would save us money in operating the facilities. But there's got to be some give and take in what we're doing, because these cuts just are unacceptable.
I was going to say, educators have said somewhat the same thing. They're getting paid less, but if their hands were untied in certain areas, they could at least have some wiggle room about how they spent the dollars and have more managerial control. I think you're saying somewhat along those same lines, that you're forced to spend money in certain areas that maybe you could better spend somewhere else if it wasn't mandated by the state. But let's just say this. So you're here at the Capitol. What are you telling, A, the lawmakers, and B, if you don't get any relief, how long before you just have to start closing facilities and say we can't do it?
But that's a difficult question. Hopefully we never get to that point. We're here today to talk about the cuts that appeared overnight on Thursday night, and hopefully see what we can do about that. Our secondary message is on the 2016 budget, and what Steve just said is no nursing home company in the state. Now, Minot is not the small guy in Virginia, Illinois, or Metropolis could sustain these cuts over a year. It's just impossible.
Yeah, it will not work. We'd have to reposition the entire business premise and not serve a Medicaid population. What will happen to those people? That's a question that has to be asked of our legislators and our administration. What will happen to those people that are unable to get access to quality long-term care?
I know, and we talk about government spending all levels, and that was one of the ones, as I shared with you, that always stuck with me. We often think of a bunch of high-paid bureaucrats doing things and wasting money here and there, and surely there is waste in government, but that was the example that always stuck with me. What are you going to do, push a quadriplegic out onto the sidewalk? Mm-hmm. Or you can't say to someone who has Alzheimer's they should fend for themselves. But gentlemen, thank you for sharing it, and we'll follow this issue, and good luck to you.
Thanks for hearing us out.
Thank you very much. We appreciate the coverage.